My name is Anca del Rio, and on behalf of the Young Forum Gastein, I have the great pleasure to host this interview today and talk with the winner of the European Health Leadership Award 2021. Before kicking off, just a few words about the European Health Leadership Award. This prize is a recognition of the achievements of individuals or organizations that display exceptional leadership in safeguarding and improving health in Europe. It's a way of expressing gratitude for their impactful and innovative work, and it also enables the initiative to become an inspiration for others and support them in generating greater impact on health and societal well-being. 2021, it was already the 15th edition of the award, organized, of course, by the European Health Forum Gastein and financially supported by the Austrian Federal Ministry of Social Affairs, Health Care, and Consumer Protection. The 2021 edition focused on a highly topical matter. It sought initiatives concerned with the health and well-being of the health workforce in Europe. And after a careful revision of the applications in late autumn, the winner of 2021 edition was announced, the European Society of Intensive Care Medicine. Today, we are glad to have a talk with the president of the European Society of Intensive Care Medicine, and Professor Maurizio Cecconi. Congratulations on the award and thank you for joining us today.
Hello, Anca. Thank you for having us today and to have this chat with you today.
Let me just start then with the first question, because I am sure that our listeners are very eager to find out even more about what's behind your hard work. And I would like to know, the European Society of Intensive Care Medicine provides training for healthcare personnel who work occasionally in the intensive care units. But could you tell our listeners more about the work of the society and specifically about the lives COVID-19 and C19 space initiatives have actually revealed?
So yes, we are a very large society, the largest society in Europe of individuals working in intensive care. We're actually a global intensive care society, but our core is European. So more than 70–80% of our members are from Europe. We have about 10,000 members, and we represent everyone that works in intensive care, from doctors, nurses, physiotherapists, and so on. So intensive care is indeed about the team, and we always provide training to specialists, to trainees that they want to embrace intensive care as a career. So that's always something that we've done for many years, actually for 40 years, because the society this year is its birthday and it's 40 years old. But the pandemic posed an unprecedented challenge, because as you know, we were really stretched over our normal capacity. We really had to surge capacities in Europe to increase the number of ICU beds. And often a lot of discussion was around ventilators, monitors, beds. At the beginning, that was an issue, but the reality that was sorted out, I would say, relatively quickly. The biggest problem that we had was that in order to look after ICU patients, we need skilled people, we need trained people. Now, it's impossible to train specialists just in a few weeks or months. It takes years, and we made it very clear for everyone that we could not do that. But we thought that we had the urgency as a society to become a hub for information and for training during these unprecedented challenges. So that was the idea behind two major events. One was at the very beginning of the pandemic, a month from the start in Europe. We organized a live C19, which was a marathon of about 12 hours, where we brought together everyone around the world to tell the story and share information, fighting disinformation, bringing knowledge that was becoming more and more available for the wider community. And during that event, we had about 130,000 live connections of clinicians from everywhere in the world. It was probably the first and the largest of its kind at the time, at the beginning of 2020. Following from those experiences, and I have to say I'm very proud of our members and how they supported us in this idea. because we decided to open the doors of the society to everyone. So it was not anymore about membership or about members, it was the members offering their support to support our actions, and indeed to offer the services of the society to the whole clinical community all around the world. And the second project that you mentioned was in this line in Europe. The European Commission listened to our suggestions and they decided to fund a training program for healthcare workers not working regularly in intensive care. This is the story behind the C19 space, which stands for COVID-19 Skill Preparation Course. You don't become a specialist with it, but you can acquire basic skills to help an ICU team during a surge. And this we thought was very important to give skills, but also to give a sort of psychological safety to the ICU teams, to the healthcare worker that was coming to work in a non-familiar environment, which can be very stressful. And we're very glad that with the help of 70 experts, more than 2,000 trainers across Europe, we managed to involve more than 20,000 healthcare workers that benefited basically from this program, and we received very good feedback. And so we are grateful for the Commission support and funding, and we are very proud that we were able to organize and deliver this training, which has helped healthcare workers, but more importantly, patients and families in Europe.
Absolutely. These are amazing numbers that you just mentioned, Maurizio. I have to say, I haven't known some of these informations myself, and it's incredible what you achieved in such a short time frame. And, you know, in the end, it's incredible to see how much the collective action can do and how much we can change the paradigm if we join our forces and do things together. So I am absolutely sure that this is one of the right examples that we also want to remember after a certain period of time, when the pandemic hopefully is going to be way back and we turn the pages, right? What about the leadership? I'm wondering what kind of implications these 2 years that have passed have had for the leadership. What did it imply to adapt to a new situation in the hospital setting, but also in your organization and in the teams that you have prepared?
It's a very good question, and I think leadership is being particularly challenged, not just for me, for the society, for everyone in healthcare. I think you mentioned a very important word there, to adapt. And I think that was key to be fast and to adapt the leadership to the need and to the goals that were very specific and very different in different times of the pandemic. I remember I was one of the first doctors to see COVID-19 sick patients in Europe, because I work in Lombardy, and that was, as you know, the first major cluster outside of Wuhan in China. At the time, I was the president-elect of the society, and I remember spending a lot of time speaking with the president and my friend Joseph Keseshoglu and the leadership of the society, telling them basically from day one what I was seeing in the hospital and what I was seeing in this community. And you have to remember that at the very beginning of the pandemic, there was a lot of confusion. I would say confusion is still ongoing now sometimes, but there was a lot of disinformation. There were still a lot of people saying this is just a flu. Some people, they were on TV saying, you know, there will be nothing, don't worry, what's happening in Lombardy, it's unlikely to repeat itself somewhere else. And the common reaction of humans during a crisis, during an unprecedented crisis, sometimes is to deny the crisis, to wait time, to downplay the threat, to think, well, let's wait more data. Maybe what we are seeing is just something that is a bit strange, but we don't have to worry. It's common, but it's the wrong thing to do. When you have something completely unprecedented, you have to collect the data that you have, and data may not be perfect, but you have to act on urgency, with urgency on that data. That is why during the first 10 days, together with the network of ICUs here in the region, we were collecting all the data on admissions, we were sharing resources, and we were making that data available for the wider community. Indeed, probably the first thing that we did with the European Society was actually disseminating a letter that I wrote with two colleagues, Antonio Pesenti and Giacomo Grasselli, on behalf of the network of ICUs here in Lombardy. And that was our experience of the first 10 days of the pandemic, with a very simple message. It was, this is real, get ready, because if you're not ready, if an outbreak comes to your areas, you may lose a lot of time to put an action plan in place. And we don't want people to be in the situation where we were, which was very difficult for us at the beginning. Now, those were the very first days. Those are the days that prompted us to act as a scientific hub, as a society, to bring people together, to filter information so that we could get rid of disinformation and provide everything that was available to the clinical community. And that's when we started to do the webinars, the marathons, and so on. But of course, you know, the situation has evolved. You know, it's been an unprecedented 2 years of scientific discoveries, of research, of solidarity among researchers, pulling data together, putting everything together. I'm also part of a clinical guidance committee of the WHO, where we review the evidence while it comes out, and we can make recommendations, for instance, about which drugs to use. This was incredible. Never in my life I've seen before researchers worldwide putting together the data even before publishing their own paper. That was amazing, and it really helped to gather scientific evidence to recommend what could save lives at the bedside. And not to forget, you know, the development of vaccinations in record time, and all the solidarity that we got from citizens deciding to vaccinate in such a large number, which made the pandemic much more manageable for us over the last 2 years. So, you know, if I see the last 2 years from a leadership perspective, we had to adapt. I had to adapt locally, but we had to adapt as a society, because the situation was changing continuously, and you know, your attitude was right in that moment, but you had to change it maybe 2 months later or 3 months later, and so on and so on.
I can only imagine that this has been challenging from the outside, but incredibly difficult at some point from the inside too. And I wanted to ask you, how did you cope personally during this time with all the information, with all the stress? Mostly, we have been talking in so many discussions about mental health and well-being of healthcare workforce, right? And you also mentioned in the first answer, I think, that this has been an incredibly challenging year, 2 years actually, for the workforce, not only for their skills, but also to keep their mental health safe. So how did you cope with this personally? What is it that has kept you strong and positive, so that you mobilized so many resources and achieved the success that you mentioned?
Well, I can give you this answer on a personal level, and then again on a level as a society, because, you know, when you work in a group and you are cohesive with a group and you perceive this solidarity, you know, every burden becomes less heavy to carry. On a personal level, I have to say the first few months where we knew so little were difficult, even for me, and even if I was trying to stay positive. You know, we didn't know if we would get infected as healthcare workers. Now we know, you know, 2 years later, that the personal protective equipment and being careful, having very strict procedures about donning and doffing, you know, that helped a lot. You know, I remember during the first wave, for instance, I was lucky to have a couple of days to prepare before the first patients arrived in my hospital, compared to others that did not have the time. I used the time to bring a simulation team in situ to train all my team to be familiar with donning and doffing, something that you train, but in the emergency situation where you have to do it, basically to be able to do it properly. One of the things that was keeping me awake at night was, you know, how would I find the resources to open the next ICU beds if we need to open more beds for patients? And how do I make sure that my team does not get infected? This was the difficult part, but if you do it together, you can do that. And of course, it was difficult also because many of us separated from our families. We were scared of infecting them, so most of us, if we could, we send them away, and we were without them. And also it was very difficult because we could not have the families of the patients at the bedside. So all these contacts of our families with us, and not seeing patients being able to stand with their families at the beginning for the restriction of the visit, I would say was very difficult, maybe the most difficult thing. But at the same time, we felt that we were supporting each other. We felt that we were doing the right thing. On a personal level, I was telling myself and my team, careful, this is not an 100-meter sprint. This could last months, maybe years, and we know that it lasted, unfortunately, some years. And even if we work very, very hard and in difficult situations, especially during surgeries, we've always tried to give some times to regain the energies. We spoke a lot. We still speak a lot. You have to be aware that not everything is perfect, not everything is pink. You know, many people are tired, and they got tired, and I think healthcare workers, they experienced a lot of burnout during the last 2 years. So recognizing that is very important, and then acting on that to prevent or to deal with it. You know, on a personal level, I always tried to maintain my balance by never getting rid of some habits that I had, like trying to exercise even when I was working 15 hours a day continuously. I was sometimes waking up at 4 o'clock in the morning to do my routine. You know, these things, they keep your balance, and you have to think that it's a balance that you have to keep maybe for the next 2 or 3 years. You don't know when this is going to finish. I think if you look after yourself, then you can look after your team better. So I was always trying to remind myself about that, and my family was trying to remind myself that too. So I'm very grateful also to my wife and my kids, you know, and my loved ones also for doing that. So this is how I try, and this is basically how we tried. And as a society, we also looked for the problem. So we did some surveys to see if there was burnout there, and indeed we find that you know, about 50% of healthcare workers working in intensive care had some symptoms of burnout. You don't have to deny those, you know, you have to recognize them and to realize that we need to look after the healthcare workers if they have to look after our patients and families.
Absolutely. That's incredible. That's incredible, because I think that it's so important, the moral support that you mentioned of the families, and it goes like a chain. As you said, you needed it from your family, then the workers and the people in your team needed it too, but then the patients also couldn't get there. So I assume that the healthcare workers were the families at that point of time.
We were, and that I can tell you, for most of us, that was the most stressful thing, was to work in a way where maybe at the beginning during surgeries we could not provide the quality to the care that we normally do. And having families at the bedside is part of the care that we do. We think it's very important to have loved ones there. That's why in many places we started to convince our hospitals that we've put in the right protective equipment, we could bring families in. It was not easy, but we started to do those things. And if I can just add a little bit more on this, is that this is probably one of the reasons why it was very stressful. It's exactly because if you work in a situation where you don't provide the quality that you're normally used to, it can create something that we call moral distress, moral injury to healthcare workers. I remember some of my nurses during the very first wave telling me that it was very difficult for them not to have the time maybe to shave the beard of the patient or to cut the nails as they normally do every day. Maybe they had to do it every other day, or not to be able to do those things continuously as they were normally doing. It may not change the clinical outcome, but it changes the perspective of what you do at the bedside.
Absolutely. And I think that these details that you mentioned that are part of your care and you know, goes even beyond quality of care, the term that we use, you know, in the hospital setting to measure various things. It goes beyond that, and it talks about human care and the fact that we care, right? And I think that it's incredibly important to create more awareness also in the broader community about this. These are extremely relevant cases of people who are engaged at the bedside from the beginning to the end, from the clinical outcomes until the other ones. And we all know and are aware of the implications of our mindset, right? And the patient's mindset into the healing process. So I completely agree with you. And I'm so happy to see that your teams responded in such an impressive way, I would say. And as you mentioned, regardless of the situation, that you have been a core of the COVID cluster, and for so long, everyone across Europe has been sending their best thoughts to Milan, to Milano, right, and to Italy. So I would like to ask you now, what does it mean for the European Society of Intensive Care Medicine to get the European Health Leadership Award and this recognition for your and your team's hard work in these 2 years?
It's a great recognition because, we didn't do any of this for any award, of course. We do this job because we love it and because we are a team of people at the bedside working for patients and their families. This is what, this is our drive to work in intensive care, is really, what we can do for patients and families there. And we did that because it is our passion, and we wanted to help as many healthcare workers so that they could help as many patients and families across Europe and across the world. But to get this recognition is important for our members, for us, because it's a recognition that what we've done had an impact also from an outside perspective. So, and again, it's a recognition not about the technology that goes in intensive care, it's a recognition about the people. I used to say very often during the first months, where everyone was trying to build ventilators from Hoovers or getting cheaper ways of building an ICU ventilator, that an ICU ventilator is not an ICU bed. An ICU bed is a group of competent people working together as a team. And I would say an ICU bed is only an ICU bed when you have a patient and a family there as well. One thing that I didn't mention before is that indeed, because we think it's so important for people to become familiar with what intensive care is, because whether we like it or not, most of us will experience intensive care as patients or families during a lifetime. We also created now a series of resources on our website to explain to future patients or to families that have a patient at the bedside what intensive care is. And if you look in those, it's not just about technology, it's exactly about explaining that you are not alone there. There is a team, we are there looking for you. And also the difficulties that you may experience as a patient and your family may experience with an ICU stay, or sometimes with a death in the ICU, and also with things that follow intensive care, like the post-intensive care syndrome, the post-ICU syndrome, and so on. So having this award is a recognition for our work, but also we hope that this award also bring also some attention to what intensive care is in Europe, of course, around the world, maybe to raise the awareness about intensive care, because the pandemic has put the spotlight on intensive care, but now we need your help. We need the support of citizens. We need awareness about what intensive care is, because COVID-19 hopefully will finish, but what we were doing before COVID-19 will stay there. We will still care of many patients in need in the most difficult time of their life. We need to talk more about severe infections, because infections are there to stay. Unfortunately, we name sepsis when this is in intensive care. So this award is very important for the recognition of what we've done in the pandemic, but also because we hope that you will help us to raise awareness about intensive care, because by doing so, we can only get better in what we do for our patients and their families.
Cannot agree more, Maurizio. This is the way things are. And even, as you said, even though the COVID might be soon gone, and we all hope for that, of course, after these 2 challenging years, we can only worry that it will not happen again. And if the next time it's not going to be something worse than COVID or something similar to COVID, which is scary enough, right? I wanted to ask you, do you worry that pandemic such as COVID is going to come again in the near future? Or do you have any urgent worry, to say so, at the time?
No, I don't worry, but I also think that we cannot be unprepared twice. We were not prepared for this pandemic. The next pandemic or the next global threat may be very different. And I don't think it will be responsible for the future generations, for future patients and citizens, to have our healthcare system prepared as they were this time, because I don't think we were prepared well enough. It would be a lie to say that everything went well. We need to build more reserve, more resilience in the system. We need to build this flexibility in the system, from public health to how hospitals are prepared. You don't do this just by pouring funding during an emergency. You need to have a long-term vision about training more people, about retaining more people, making working conditions for nurses that are better, so that we attract more people to the job and they stay in this job. And also be ready for something that could be very different in the future. That's why it's so important that we talk about this. That's why it's so important that we talk about intensive care, because it's a specialty that unfortunately is not known by many, because you don't choose to go to intensive care. It happened that you need to go to intensive care. But we've seen how important it is to have acute beds ready in hospitals and to be able to increase, if you need, these beds that needed. If needed. And this means, again, investing in people, investing in training, in education, in making sure that, we learn from each other at European level. It's very important that we talk, for instance, about the free movement of intensivists, because intensive care exists as a specialty in each country, but it's very different, and sometimes it's not easy to move from one country to the other because the qualification is not recognized. We have to do a lot of things to help the future generation basically to move forward.
I cannot agree more. And the one last question for you, because you just mentioned the migration of the healthcare workforce and the way that we should align the systems and everything. I think that has a rather sooner than later urgency in general, due to the lack of healthcare workers in general, and yes, in most of the European countries. I wanted to ask you if you have anything planned, or you have anything in mind, what you would like to do and how you would like to use the prize.
So maybe two answers. One is that we are already working a lot to raise the awareness in Europe and to try to build a better intensive care environment for our patients, their families, and our healthcare workers. We are also very pleased that institutions now are listening more and more to us. We had a great experience of work with the European Commission. Now the European Parliament has set up a European Parliament interest group in intensive care. So I think it's the right moment to talk more and to work now to plan for the future. In the specific of how we are going to use the award that we received, and we're very grateful for this award, we decided that we're going to use it to promote and to deliver education in low and middle income countries. This is something that we've already done also during the pandemic with a course that is called Alive C19. Alive is the name of a fund that we use basically to get donations, and we use that money basically to provide education in low and middle income countries in topics related to intensive care, sepsis, severe emergencies, and so on. And so this is how we will use the prize.
This sounds like an excellent plan, and I cannot wait to follow up with your updates and to see and learn even more about what the European Society for Intensive Care Medicine is doing. Thank you so much, Maurizio, for your time, and thank you for this very detailed explanation of the great work and the great impact that you have been leading in the last 2 years and beyond, of course. And I wish you a great day and all the best for you and your team in the near future.
Thank you, and thank you for giving me the opportunity to talk about the European Society of Intensive Care Medicine, and thank you for giving us the very important award.